Blood cancer affects hundreds of lives annually. Nevertheless, what if we were able to recognize the warning symptoms earlier? In recent years, there has been a notable increase in the number of instances of blood cancer all over the world. The importance of early detection cannot be overstated. It can actually make a world of difference. The early warning indicators, are you aware of them? A prolonged fever, unexplained weight loss, or fatigue that does not go away with rest is all possible warning signs that should be taken seriously. To be sure, there is more to it. Come along with us as we investigate the symptoms that are less well known, supported by the most recent research. Whether you are looking for information for yourself or a loved one, or you are simply looking to keep educated, this is a journey that you will not want to miss out on having the opportunity to have. Join us on this informative video that is both enlightening and hopeful by subscribing to our newsletter. Embrace the power of knowledge and optimism as we work together to discover the early warning signals of blood cancer. Let's get started on our investigation of the early warning signs of blood cancer. Number 1. Cold or fever. Fever and cold are symptoms that are frequently ignored, despite the fact that they might be important markers of blood malignancy. This connection is addressed in a research that was published in Curious in the year 2020. Leukemia and lymphoma are two examples of blood malignancies that disturb the normal function of blood cells, which ultimately results in a reduced immune system function. If your body's defenses are compromised, even relatively small illnesses might elicit symptoms such as fever and cold. It is important not to disregard these indications, particularly if they continue to materialize. As an early symptom, fever is experienced by around 90% of individuals diagnosed with leukemia, according to research published in the journal Infections in Hematology, 2014. There is more to this than just a random event. Cancers of the blood have a direct impact on the bone marrow, which is the location where blood cells are produced. At the same time as malignant cells are multiplying, they are crowding out healthy cells, which weaken the immune response. Because of this, patients are likely to be more sensitive to infections, which frequently manifest themselves as fever or cold. It is essential to be aware that these symptoms do not indicate the presence of blood cancer on their own. It is recommended, however, that you seek the advice of a medical expert if these symptoms are accompanied by additional symptoms. The effective therapy of blood malignancies is somewhat dependent on the early diagnosis of the disease. Keep in mind that your health is top priority. Receiving prompt medical advice and paying attention to the signs that your body is sending you can make a significant impact. Number 2. Continuous fatigue and weakness. For some people, persistent weakness and tiredness may not always be cause for concern, but when it comes to blood cancer, these symptoms are major early warning indicators that should not be overlooked. Let's delve a little more into the reasons why people do this. The ability of the organism to manufacture and control blood cells is directly impacted by blood cancer. Anemia is a disorder that occurs when your body does not have sufficient healthy red blood cells to transfer oxygen in an effective manner. This disturbance can lead to anemia. The exhaustion and weakness that you can encounter are frequently brought on by a sufficient lack of oxygen circulation in your body. Patients have described it as a profound exhaustion that does not improve with rest, indicating that it is not simply a standard feeling of fatigue. This sort of exhaustion may have an effect on day-to-day living, making even the simplest of chores appear to be difficult. A study that was conducted in 2023 and published in the journal Scientific Reports found that as much as 40% of individuals diagnosed with blood cancer reported having significant weariness. It is important to keep in mind that these symptoms are not specific and might be tied to a wide variety of different illnesses. However, if they continue for an extended period of time and cannot be explained, a healthcare practitioner should investigate them further. Number 3. Chest pain or coughing. It is essential to have a thorough understanding of the early warning signs of blood cancer, and it is fascinating to investigate the ways in which symptoms such as coughing or chest discomfort might be associated with this deadly disorder. When we think about blood diseases like leukemia, lymphoma, or myeloma, we frequently anticipate experiencing symptoms that are directly connected to blood, such as anemia or bleeding. The truth, on the other hand, is more complicated. The symptoms of coughing and chest discomfort that are associated with blood malignancy are typically the result of indirect consequences. One example is a study that was conducted and published in the journal Pediatric Surgery, 2012. The researchers discovered that some forms of blood cancer can result in lymph nodes that are enlarged. When these swollen nodes push against the lungs or airways, it might cause you to cough or even cause you to have pain in your chest. The cough that you are experiencing is not your regular cough or occasional discomfort. It is constant and does not appear to have an obvious reason, such as a cold or pressure from your body. Another factor to take into consideration is the fact that blood malignancies have the potential to damage the immune system, as was mentioned in the International Journal of Molecular Sciences, 2022 version. The deterioration of the immune system increases the likelihood of infections, which can result in symptoms such as a chronic cough. It is essential that you are aware of the fact that these symptoms do not, on their own, constitute evidence of blood cancer. Chest discomfort and coughing can be caused by a wide variety of diseases. If, on the other hand, these symptoms continue for an extended period of time, are not typical, and are accompanied by additional symptoms such as exhaustion, unexplained weight loss, or night sweats, it is prudent to seek the advice of a medical expert. Effective management of blood malignancies requires early diagnosis as a critical component. Number 4. Breathing problems. The occurrence of shortness of breath is frequently linked to illnesses such as asthma or cardiac difficulties. However, it can also be an early indicator of blood cancer being present. Cancers that affect the blood have an impact on the body's capacity to develop and function cells that are healthy. A condition known as anemia, in which there are insufficient red blood cells to transport oxygen throughout the body, can be brought on by this disturbance. As a consequence of this, some people may suffer a feeling of shortness of breath. There is more than simply anemia to blame for this situation. A spleen that has become enlarged as a result of blood cancer can put pressure on the lungs, so preventing them from expanding to their full potential and resulting in shortness of breath. In addition, many blood malignancies have the ability to directly enter the lungs, which further causes difficulties with breathing. It is essential to keep in mind that shortness of breath can be caused by a wide variety of factors, and not all of them are associated with blood cancer. Nevertheless, it is imperative that you seek the advice of a healthcare expert if you experience respiratory problems that are chronic or defy explanation. Number 5. Skin itching. Skin that is itchy, also known as pruritus, is a sensation that we frequently disregard as a small irritation. However, in certain instances, it may serve as an early indicator of the presence of blood cancer. When it comes to blood malignancies such as lymphoma or leukemia, the relationship between itchy skin and these diseases is not commonly understood, yet it is a crucial one to comprehend. It is really interesting to learn the explanation for this irritation. The accumulation of aberrant cells that emit chemicals that irritate the skin can occur in certain types of blood cancer. Patients diagnosed with Hodgkin lymphoma were found to endure chronic itching in about 30% of cases, according to a study that was published in Dermatologic Therapy, 2019. Regular lotions and antihistamines are not effective in alleviating this type of itching, which is characterized by a greater degree of intensity. Additionally, this itching frequently happens in conjunction with other symptoms such as unexplained weight loss, exhaustion, or night sweats from the same individual. The presence of these particular combinations of symptoms ought to serve as a warning sign. It is essential to keep in mind that itchy skin on its own is not always an indication of a dangerous condition. Nevertheless, if it continues for an extended period of time and is being accompanied by these other symptoms, it is recommended that you seek medical attention. If you learned something from watching this video, we would appreciate it if you would consider subscribing to our channel and sharing it with your loved ones and friends. We are able to give useful information and raise awareness thanks to your support. Be sure to give your ideas and experiences a like, leave a comment, and share your opinions. It's possible that someone out there may turn to your encounter as a ray of hope.